All right,
Chris.
welcome back, everybody. This is day 2 of our biathlon, our 2022 IPS California conference. We're on the home stretch here. Super excited to have Mark and Laura join us for this next presentation on IPS in rural counties. So it should be no surprise that in California, like most states in the country, it is made up mostly of rural counties. So fun fact, out of our 58 counties here in California, 39 of them are considered rural. So these are counties that lie outside of a metropolitan statistical area. And that's 67% of our counties here in California are considered rural. And within these counties, 80% of our of US forest land in California lies within our rural counties. Rural counties have different considerations and access to resources when wanting to launch new programs. And we've got 2 experts who have done it in rural counties here. They're joining us today, and they're going to share with us tips and tricks on how they were able to successfully launch IPS. As a reminder, the chat is disabled, but the Q&A is open. So throughout the presentation, as you guys have questions, please put those into the Q&A. Toward the end, we will pose these questions to both Mark and Laura. So without further ado, I'm going to turn it over to you both to introduce yourselves and to jump right in.
Well, Laura, I'll let you introduce yourself first.
Well, okay. Hi, sunny California. I am Laura Flint, and I use she, her pronouns. I am talking to you today from Waterbury, Vermont, which is the home of Ben and Jerry's ice cream factory. A lot of people travel here from all over the world to tour the factory. And we have a very rural state. You have 58 counties. We only have 14 counties in Vermont. I'll leave it at that. Thank you.
Thanks, Laura. So I am Mark Liverman. I work from the Tennessee Department of Mental Health and Substance Abuse Services, where I serve as the Director of Wellness and Employment. I use he, him as pronouns. Very happy to be with you all today virtually. The plan was to be in my office, but if you can tell, I'm in my truck. So had a bit of a conflict, but I'm very happy to be here today. I'm going to run through the first couple of slides, and then we'll have Laura interject where I make a mistake, which likely could happen here in the next few minutes. So the content of our presentation today is pretty straightforward. There is an advantage to using IPS in a rural community, and we're going to share some of those ideas. And then we'll talk about some possible challenges to using IPS in a rural area, and then how those problems could be resolved. These are just some of our ideas and how it has worked in Vermont and in Tennessee. And also there's a few documents that we shared with Theresa that has been published by the IPS Employment Center that is currently on their webpage. Laura took part in drafting those documents, so she, the 2 of us, is the expert in this area, Chris. So if you, I'm just, we in Tennessee, we've used IPS since 2013. It has grown from there. But as you might guess, Tennessee is primarily rural, right? There are basically 5 major metropolitan areas, but the rest of the state, there are 95 counties in Tennessee. So the 90 counties that are rural is what I'll be sharing information about. And then lastly, we'll talk about how do you fund IPS? And that's both from a rural perspective and from an urban perspective. The great thing about learning how a state funds IPS is once you learn how that state funds it, you learned how that state funds it. That's pretty much it. Each state is uniquely different, but Laura and I will share some ideas of how we're funding it in our state. So next slide. So what we know about IPS, and this is both in rural and urban communities is that work is the best treatment we have for serious mental illness. And that is the driving force behind any expansion or any building of an IPS in a new community. You all know this, but 2/3 of people with serious mental illness say they want to work. And that's why we do this type of work. In Tennessee, I'll talk about the first bullet, and that is Tennessee Executive Order number 1. Our current sitting governor, when he took office about 4 years ago, and he's up for re-election this year, he will likely win that election. But his first order from his office was a rural impact focus. That is, that order required all state departments to respond how we were providing services in rural communities. So as you might guess, that has resulted in many state departments, including the Department of Mental Health and Substance Abuse Services, focusing on how we are impacting the community, both with crisis services, youth, young adult services, substance use disorder treatment services, and IPS services. So currently in Tennessee, there's roughly about 55 IPS teams, and 27 of those teams operate in a rural community. So just about half of our teams are in a rural setting. With regard to transportation, and Laura, I'll cue you here in a few minutes if you want to talk about that piece. With regard to transportation in a rural community, you got to think outside the box, natural supports, using family members, using coworkers. And the next slide talks about, the idea of using those same ways that we get to church and work and to a ball game. How are people getting to those events if they don't have transportation? Well, they're catching a ride with somebody. And that's the same approach that at least we've taken in Tennessee to try to help people get to work. Laura?
Yes, and Vermont being as rural as it is, having a car and a license is obviously very helpful. For some people, vocational rehabilitation has been able to help with that. There's also, I don't know in your areas, but here there are some programs that will take used vehicles and then sell them for a very small amount of money, like sometimes $1,000 or $2,000, which then Voc Rehab can help fund. So people have been able to get some cars, but then also bikes. Like people actually do bike, even in the winter, people are biking. And we have our transportation authority also has a program where they will pay someone mileage to pick up somebody at specified locations and take them to work. So it's our transportation authority in Vermont. It's called RCT, which means nothing to you in California, but it is an option. There are always pros and cons. That one is sometimes people are late to picking up the person and therefore they're late for their job. So you're going to hear over and over again, it's about relationships. And sometimes even neighbors can help with transportation. So it's, and folks that you might know in that person's circle of support. And then, of course, case managers have helped with transportation as well and use that time to connect with the person.
Yep. So another advantage of having an IPS team in a rural community is people, right? So the bullet says, I know Joe, right? But it's a smaller knit community. I grew up in Columbia, North Carolina. And I would imagine if I could see everyone's hand, nobody's heard of that place. In reality, I grew up outside of Columbia, North Carolina, which is really small. I think Columbia has about 500 people as a population. So I know how close knit a rural community can be. And when you have a smaller area, the chance of building those relationships has likely already happened. So you got smaller mental health centers in the rural areas, and they can also, going back to the transportation piece, can also provide some support with transportation, right? So you're not having to build relationships with, as Laura said, you're going to hear that word quite a bit. You're not having to build relationships with a large organization and trying to get buy-in from that organization. The likelihood of people knowing each other and what everybody does in the town is probably increased. So that's an advantage to operating in a rural community. Additionally, employment team members, IPS employment specialists, and team leaders likely already know the employers, right? So that smaller knit community, smaller area does provide some advantages. Any thoughts on those 2 points, Laura?
I think you did a nice job covering that, Mark. The piece with employers, again, that's going to be probably one of the #1 strategies that you'll hear us talk about, which is getting out there and getting to know your employers if you don't know them already. Because in small areas, it's a lot of smaller businesses. And if you do have larger businesses, it's harder to make an in-way for somebody wanting a job unless you know people that are working there, that are the hiring folks. But a lot of times it's networking. And we joke in Vermont, it's not 6 degrees of separation, it's 1 or 2 degrees of separation, if you know the Kevin Bacon analogy. But it really boils down to networking. A lot of jobs that become open aren't even advertised. So,
yeah, very good point. And since you all know that IPS is driven not only or measured not only because of its effectiveness, that is, we see people getting jobs, right? But the data drives the effectiveness of IPS. And what we know about employment outcomes is that there's really not a significant difference in urban or rural US programs who are part of the IPS Learning Collaborative. That relationship piece is the key. Relationships with urban businesses and relationships also with your rural areas. And then I might have skipped a point here, but also the likelihood of there being a stronger relationship with vocational rehabilitation is increased, right? So your mental health authority likely knows who the VR folks are. And so again, that's another advantage of working or using IPS in a rural community. I'm not sure who's controlling the slides, but you can go to the next one. So I'll let you lead this one, Laura, if you don't mind.
Sure. Yeah. So we did mention the transportation options, and another piece we didn't talk about was creating a team or a task force in your area to talk about what are some of the barriers, but also what are some of the strategies. And that has worked in Vermont in terms of addressing maybe local challenges that exist. California is such a large state, it probably really does depend on those local coalitions. And then just as an example of business connections, I used to be an employment counselor. I didn't share actually what I do for work. I work for our Department of Mental Health, and I provide training and support to our IPS programs in Vermont. But before that, I was an employment counselor, and I was at a show, Ben and Jerry's again. They put on musical events, and I was just sitting there on my blanket listening to the music and overheard somebody in front of me talking really loudly because of the music, saying they worked at a camp and could not find someone to do cooking. And they were feeling very desperate because the camp was about to open soon. And I happened to just lean over and say, I couldn't help but overhear And I'm actually, I might have somebody that could fill your opening, and we exchanged information, and the person actually was interviewed and got the job. So I think in small communities, your typical approaches are helpful, but also being very creative, and you're just job developing 24/7. It's, as an IPS counselor, the person would be just always keeping their eyes and ears open. So that's a very helpful tip for rural areas. Yeah, and I think we did talk about the business piece, so we probably could go to the next slide, unless you have more to say, Mark.
No, I mean, you all will have access to the slides and the data that I previously mentioned that is posted on the IPS Employment Center's webpage. So how do you overcome negative perceptions? In a rural community, just like we've mentioned several times, everybody knows each other, right? And so when you have a person who has a negative reputation, a job seeker who may have a negative reputation, how do you overcome that? Well, the same way that we overcome our own negative perceptions, right? You try to focus on your strengths, and you try to focus on that person's strengths. Everybody has strengths. And that's what you want the potential employers to know. They may know the person's reputation, and that they may not be looked at in the community in a positive light, but they also have positive qualities. So with regard to the job seeker, you want to focus on that person's strengths. Be persistent. Focus on the IPS basics, and that is going out and, again, building the relationship with the employer where the job seeker wants to work, and making sure that they know that this person also has positive qualities. Allowing the employer to meet the potential job seeker and let the job seeker himself or herself share what their strengths are. And then also, you want to build relationships with prominent employers in rural communities. One of the prominent employers in our state is FedEx. And so if you have somebody working at FedEx, then they could speak, about that employer could speak to smaller businesses about the advantage of working with the program and hiring IPS clients. When you have a success story, blow that up. I mean, get a video caption of that particular person working and interviewing the employer. We have success stories on our webpage, and they're not there for people to be entertained. They're there to show, perhaps naysayers that IPS clients can do work and can work just like everyone else. They have strengths, they have abilities, and that's what we want to focus on to try to overcome the negative perceptions. What about vocational unit, Laura?
Well, I think that's an area where there's a lot of concern. If a program really is focused on getting that high fidelity rating, the employment unit is an area where it can sometimes be tough to get a rating of 5, because you need 2 full-time employment staff plus your supervisor. And in small rural communities, especially community mental health centers, there's just not enough staff, or maybe there's not enough people being served. We have our smallest center in Vermont serves about 120 folks, and they only have 1 employment staff person. So that agency won't be able to get a 5, on that item. However, that person really connects with other employment folks in the area who are also doing employment, and works with our employment staff throughout the state for getting support and talking about strategies for helping job seekers find, employment or education. So there's that piece. And then also, I can't speak to how it is in California, but in Vermont, sometimes the agencies are spread out across large distances. So they rely heavily on remote means to stay connected. So that's one way of helping in a rural area. It actually used to be like conference calls. and now, of course, we're all using video conference calls. So they stay together in touch that way. And they rely on their vocational rehabilitation partners in the community as well to help balance out some of the duties. And the relationships they have with their fellow case managers is also pretty critical. If there are things that the case manager, small things that can help facilitate when a person has a lot of responsibilities on their plate as an employment specialist. But ideally, you're working with the agency to increase the number of staff as much as possible. And we're constantly doing that here, saying having another employment specialist is actually more beneficial than another case manager. And using the data and the research and personal stories to share why that's really important as a way to grow your team.
Yeah. I'll mention real quickly, and Laura, if you wouldn't mind taking the next slide, and I'll chime in. But as we go to that next slide, I'll mention that recently we got approval, and this will lead us into the next subject, to expand IPS in Tennessee by 44 positions. So we are increasing our ability to serve roughly 770 more clients than we have the previous year. And the way we were able to do that is success stories. I mean, sharing how effective IPS is and how creative employment specialists are with helping a person find the job that they want. We showed how not only are they getting jobs, but we focused also on retention. They're not just getting a job and then, we walk away. As you all know, IPS employment specialists stay with individuals to ensure they are successful at work and are available when they run into concerns at work. So success stories allowed us, sharing those success stories with legislators, sharing them with our department leadership and VR's department leadership, created a partnership, created an opportunity where we could expand by 44 positions. Okay, you can take it from there, Laura, if you don't mind.
Sure. So first, I'll share some information about Vermont, and we have been doing IPS since, probably the trees in that picture you're looking at were just little shrubs. So we probably started in using IPS supported employment in about 1999, and prior to having IPS, we were providing supported employment services, and those were funded pretty much by Voc Rehab. So relationships, again, you're going to hear, are super important, but because of the relationship we had between the Department of Mental Health and vocational rehabilitation, which in Vermont we actually call Higher Ability, they have changed their name. That relationship allowed the application for a grant to Social Security, and it was a 5-year grant that we received, and that's how we were able to implement IPS. It didn't provide funding to our programs, but it provided funding to do the training, and it also had benefits counselors attached to it. It was a Social Security Administration grant. But that came about because of the partnership between Voc Rehab and our mental health. But Vermont, we have about 624,000 residents in our state with 14 counties, as I mentioned earlier, and our largest county has about 168,000, where our smallest county has just under 6,000. And actually the town that I'm talking to you from only has about 2,300 people. There's very small locations, but the reason why we were able to fund in this small state without a lot of, we don't have a lot of mental health block grant funds. Like a lot of states I think, use mental health block grant dollars, but ours is very small because we're a small state. So Voc Rehab was providing grant funding to each of our 10 mental health centers. And that allowed the programs to provide employment services that weren't paid for by Medicaid. And we started out with a fee for service, but I feel like the perfect storm in a positive way was that we implemented IPS. So the programs knew how to provide this quality service, but we also switched to 1115 Medicaid demonstration waiver. And that allowed our mental health centers to be able to provide employment services. So we had the beautiful mix of VR dollars and this new way of funding services in mental health. That started in the early 2000s. And to give you an example of, so I think we had like a 10% employment rate for all folks that were receiving mental health services in our community rehabilitation and treatment programs, the programs that serve people diagnosed with severe and persistent mental illness. So we had 10% employment rate with the mix of implementing IPS, helping create some flexibility with funding. We had benefits counselors. We had, I think, around a 33% employment rate. That's for everybody receiving services that had a mental illness, not just the people in our employment programs. So it really had a pretty big impact on outcomes. We only started our 1115 waiver with our mental health SMI, the severe and persistent mental illness programs. We just started small. So knowing whether your funding covers employment or not is important. So when we started with fee for service under Medicaid, we could only obviously provide services that were medically necessary, but that still can include looking at the barriers to employment and providing those community supports and being very creative around how you're helping someone. We also had the VR dollars at that time, so that was helpful. And we then expanded into, so it took us almost, I don't know, on our webpage, it says 2005. I feel like we implemented it earlier, but if you go to Vermont's Department of Mental, actually, I can send the link to Theresa, won't bother you with the details. You can read about the 1115 waiver if that is something that you're thinking about. We expanded it to our youth employment programs in 2012. And then in 2019, we've just expanded it across all of our Department of Mental Health services. So children, youth and family, and adults and youth employment programs. And so far it's been going pretty well. I also want to say starting small is important. So even though we had that funding to provide training, the programs didn't get additional funds. We had to find additional funds through grants. We also had some Johnson & Johnson dollars, which was the IPS Center had a relationship with Johnson & Johnson, and there were some seed dollars there. But again, we're only talking $10,000 or $15,000 for an agency, but it helped. It helped create champions, and that helped with the agency culture and expanding the excitement for IPS and seeing, as Mark said, about how people were being successful and hearing those stories. It just really built the momentum. I do think being creative with grant applications is important. And that leads back to your relationships. If you can partner with NAMI, the National Alliance on Mental Illness, your peer advocacy groups, United Way, Department of Labor, Voc Rehab, your Chamber of Commerce, if you're partnering on those applications, it's going to be a stronger application, and that can be very helpful. Also, those organizations have funds, and they might have ways to give some funds to your mental health centers.
Yeah, so the story in Tennessee is a little different, but you remember when we first started talking, we said when you learn about one state's way of funding IPS, you've learned one way, right? Um, so in Tennessee, we started in 2013 promoting IPS by partnering with 4 mental health centers, and we in collaboration with VR, so they have access to VR milestones for employment services reached, like career profile, placement, and such. And then the Department of Mental Health directly funded the agency's staff for the IPS team. So that started in 2013 with 4 sites, 4 teams, and we've just slowly grown the program from there to now roughly 36 sites or 36 teams. And we'll have, once this expansion is done, just about 100 employment specialists statewide doing the work. So let me answer the question about how we were able to expand. So again, those success stories, we have block grant dollars, as Laura mentioned earlier. And we also have direct state appropriation that we're using to fund IPS teams. And that's how we were able to expand. We had some state dollars, and then we partnered with VR, and they were able to use their match dollars with their federal partners to draw down roughly 4 times as amount of state dollars that were used. And so it didn't cost the state the entire expansion costs. And so there was a way to sell it to legislators, hey, we can serve roughly 740 more people with this small amount of money. And we'll use this money to partner with VR, and they can pull down their match dollars, and we'll have 4 times as amount of dollars to use to expand. So that was a good selling point for legislators, and it worked. So we're in the process of contracting with the 14 mental health providers to expand IPS. Roughly 8 of those are in rural communities. We also are using those expansion dollars to grow our IPS trainer team. So we started with 1 IPS trainer, and once this expansion is done, we'll have 4 IPS trainers and 2 benefits counselors also that will be funded by this expansion. But if we haven't said this enough, let me say it one more time. Relationship building is really key to using IPS in rural communities and any type of funding or expansion opportunity. And Chris, I know there was a few questions, and we may have time for a few that you might have had to ask. And Laura, if you didn't have anything else to add to this slide, we can go to the next one, which has our contact information. Go ahead, Laura.
Well, I did want to say one bit about recruitment and retention of staff, only because in rural areas, sometimes it can be hard to, right now, everyone is struggling with finding staff, right? It's the challenge of the year. I think one thing to mention about that is just being thoughtful about your job advertisements and what those have written in them. I think a lot of times there's the typical, the background experience you're looking for. Sometimes it's helpful to think about personalities of the folks that make good staff and being creative about how you write your job advertisement. So you're not just copying your HR job position language, and posting it in very creative locations, not just your online locations, but in cafes and in churches and libraries and local organizations and in your local newspaper. You want to find staff who are going to embody the energy and look and sound like the folks that they're supporting. So I think if you're being creative up front, then retaining that person can also be easier. And it also allows you to expand your networks. So I would also say it's important to think beyond just your local or familiar networks and really challenge yourself to go farther than that so you can increase your level of diversity with your team. So yeah, I'll say that. And just that, you know, it does take quite a bit of effort and partnerships, but, you know, having that creativity and that resolve, the ongoing and open dialogue, there are ways to fund your programs.
Well, Laura, Mark, that the information you guys provided was so rich, and just, you know, me sitting in a metro area, you guys brought up so many points in considerations that, you know, have just never, you know, come across my mind. But you know, it can be done. You know, you guys talked, you know, at the high level programmatic, you know, arena, as far as, you know, the funding and braiding those and looking, you know, kicking over stones and looking under the couch covers, you know, just doing what it takes to find that funding to make things happen, even down to, you know, just the boots on the ground aspects when you're talking about, you know, small tight-knit communities where, you know, people might be infamous, you know, or have a reputation, you know, just sort of addressing those issues and really, you know, considering, you know, those networks, right? Just the professional networks and also your own personal networks as well, right? And leveraging, you know, that too. Just a reminder to everybody who is in attendance, the Q&A is open right now, so please do post up any questions you have there. I'm gonna loop in Theresa Razzano, my co-moderator here, for some thoughts, and then I know Theresa and I both have a couple follow-up questions.
Hi, Laura and Mark. That was amazing, super helpful. But you know, one of the questions that comes up for me is, how did you get the state to buy in? Because I mean, in California, the Department of Healthcare Services is like just a big insurance organization that covers, you know, primary care and mental health. And so trying to find the carve out for the state of California to get that kind of traction to support employment is kind of the elephant in the room for us.
Well, I would love to say I had something to do with it, but I did not. We in Vermont were lucky to have an amazing woman leading our Department of Mental Health, and she had developed some very strong relationships across the board. And I think what helped us also was starting with IPS and then being able to share the success stories around how this was so important. And it's a great question, Theresa. I mean, there was buy-in from the Department of Mental Health leadership that this was extremely important for people's recovery and social recovery, as well as, you know, physical and mental health recovery. So I think, yeah, I think just continuing to share the message. I will say that there are always changes happening at the federal level and then again at the state level. And so our waiver was just signed again for 2022 to 2027. I'm a little concerned about where employment will continue to fit in with that, because eyes on the waiver have grown. But so far it's still there and it's still working. But yeah, I think, and that person who was such a strong leader is no longer, she retired, so.
Yeah, well, like Laura, I'd love to take the credit for it, but it is not my doing. And also, like Vermont, we have a pretty effective commissioner. She has a great relationship, and we'll start at the top of state leadership in Tennessee. Great relationship with the previous governor, a great relationship with the current governor. both of which are of the same political persuasion. So that has helped us. You know, she's pretty dynamic also when she presents to in a budget hearing. She'll start with a song and then, you know, relate that song to her presentation. So she's pretty effective in building and maintaining the relationship at the state legislature and governor level. That has helped. But as Laura mentioned also, I mean, we could have really just said the same thing for Tennessee and Vermont. The quote that's on the slide is something that we emphasize. IPS practitioners believe that employment is a part of recovery and not a reward for having recovered. And so that message is continually being said, both verbally in written form and in demonstration through these success stories. So I think that Vermont and Tennessee are pretty similar in the way that we have, you know, gained state buy-in.
Well, I really hear the grassroots approach and identifying champions as being really significant.
Yeah.
And I might add too that people with lived experience and family members and people that are providing support in different ways, that voice has been and continues to be really important. So if you know, you're not getting it from the leadership at organizations, if, you know, advocates can also speak loudly and hopefully get traction that way too.
Well, I think in the state of California, this is the first year that I've seen just a few glimpses of interest from the state. You know, the most fundamental one is a CalAIM that is rolled out July 1st for us, changes the way every Medi-Cal practitioner in the state of California documents their time. And part of that was to emphasize 5 social determinants of health, 2 of which are education and employment, or, you know, income, the economy. You know, and so that I feel is like our foot in the door, although I haven't said it before. I heard from a reliable source that they almost forgot to give us Z codes, which is exactly the codes that employment providers would use in order to bill Medi-Cal. Somebody reminded somebody at the top, what about the employment Z codes? Oh, yeah. So again, it's like just trying to make it louder, you know, that how do we, you know, support employment services? How do we, you know, as Marcus said, you know, that employment is a part of recovery, that this is an intervention. It is not a reward for, you know, once you are recovered, it is part of the journey, you know, whether it's in large metropolitan areas, you know, with 10 million people like Los Angeles, or, you know, a small county like Alpine that has less than 1,200, right? You know, it's how do we, you know, get that message home?
Yeah, and I'll just say one more thing about building relationship with legislators. Our commissioner has been in our department for many years, and she has relationship with conservative members of the legislature and liberal members of the legislature, and good relationships with everyone. So she's been able to maintain her status or relationship with those legislatures, regardless of who takes office. And she said to us recently about some ideas that we had that we wanted to promote that were not approved by the legislature. She said, I've been around this long enough to know that because of our election system, changes happen, right? And so you might not be able to do it now. Let's wait till next election cycle. You might be able to do it then, but those relationships are key to create buy-in.
Well, you know, I would also like to hear, I know, Laura, you didn't want to get into the weeds about the 1115 waiver, but there's been a lot of discussion in our state about, gee, if we had the waiver in place, it would just sort of pave the way for different counties, large and small, to incorporate this IPS employment services. Can you talk a little bit more about it and how it works?
So I only can talk from a sort of a high level, and I can say, it does allow for alternative payment methods. And the way that we started, it was small. We didn't go big. We started small. It was just with our community mental health centers, the severe and persistent mental illness diagnosis. You have to be eligible, right, for those programs. And, that's the chronic illness category. So it started out as, we called it, a case rate. And so it had a tiered approach where the staff had to look at who they were providing services to and say, is this person in a low tier, a medium tier, or a high tier in terms of services? And then they just had a lump sum of money based on the tier that individual was in. And so it would be a monthly payment to cover services for that month. It had been that way for many years. So and the goal had always been to move to a single payment amount to create efficiencies and equity across the board. But it literally took almost 20 years before we got there. We just started in 2019 and we called it payment reform, where now it's one single amount. And whenever you make changes, it can create, some challenges. It has been working okay. The point is to increase outcomes, quality of services, while decreasing unnecessary services. But lumped into that is the ability to provide employment services. I have to stress that employment is not a service that is considered medically necessary. So it doesn't trigger their payment. But once their monthly payment is triggered, they can provide employment services because it's an alternative service that contributes to the person's overall wellness. So that's part of the waiver. And the way that we collect our data is not using Medicaid data. We have a separate way of collecting data from the mental health centers that allow us to see what kinds of services are being provided. Is it employment? Is it community supports? Is it therapeutic supports, psychiatry, medical supports? And we get those monthly reports for us to be able to see where are things at. One thing that we did lose when we went to payment reform was, I feel like, a stronger focus on employment, and that's because of Medicaid rules. So that's, I don't know if it's really helping you with how that works. Vermont is the only state that has a managed care organization as part of the state. So it's a public entity. It's with our Agency of Human Services. And we're the only state that operates that way using the Medicaid dollars. So it's a little complex and complicated.
Yeah.
And
well,
yeah.
I think, in California, we have the Mental Health Services Act, which is a bonus in the state, to be able to validate, accessing funds to support employment. That's what the whole Prop 63 back in 2006 was launched as the millionaire tax. And the benefit is that it's specific to evidence-based practices and recovery supports, employment, and housing, right, which are kind of key foundations of recovery. And so even small counties should have allocations of those funds, so that could act as seed money, but then the sustainability and how they bill their time. Is going to be, how they can build non-Medicaid funding of billable types of services to Mental Health Services Act. So that's one way, in their local DR. The waiver, I think, would still add some additional flexibility, and attach it, incorporate it into that plan. So it's a useful thought.
Yeah.
How about stigma? I mean, it's interesting. We have about 124 people in our session right now. And, when we had people say hello to us yesterday morning, what counties they were from, I was, remember reading through the list, looking for any rural county. Chris, did you see any? I mean, if there's anybody, watching right now, I would love to, go ahead and jump in on the chat and tell us where you're from, because, even though half of our state is rural, such a large percentage, there's still, I think, a lot of rural counties don't even think that employment is possible. To have an employment program is even, something that they can pull off. And so I guess I'm wondering if you ever were faced with that kind of challenge around, because of the resources issue, because of the transportation issue, the distance between employers, that kind of thing. I'm wondering if either of you ever faced that.
Well, one of the ideas that came out of the executive order that I referred to earlier, when we focus on rural counties, is we created a rural recovery kind of mobile hospital. So we took basically RVs and converted them into mobile mental health services. So where the people living in the rural communities can't get to a mental health center, we're taking the mental health center into their communities and parking in, like, a Kroger or Superstore parking lot. And they're able to come to the van, get assessed, get access to crisis services, get access to several mental health services and substance use services. And what I would like to do as the director of supported employment is also have them engage with employment specialists at that location. And so you're right, Theresa. So one of the challenges is getting the information to the rural communities, because a lot of communication in rural communities happens by word of mouth. And so if we can get them into the habit of expecting this rural recovery van to come into their community on certain days or certain weeks or certain times of the month, then we can hopefully change the conversation, that, they're coming and they're bringing a number of resources to them. So, I mean, to answer your question directly, you kind of got to go there. You can't expect a letter or an email or whatever to be read. You kind of got to be in their community and be part of their culture. I remember being an IPS trainer and helping an employment specialist, a young employment specialist, learn how to job develop. She said to me, well, they only want to hire their family members. And I said to her, well, you need to become one of the family members. You need to become Cousin Deb, so when they run out of family members to hire, they know they can call Cousin Deb. Or let me say it in a Tennessee way, Cousin Deb, right? So what's the answer to the question? Well, in Tennessee, or from my experience, is you got to go there. You got to shake hands. I mean, IPS principles teach us this with regard to job development, right? You got to introduce yourself. You got to listen to them, listen to what their concerns are, and then you start asking how you can help. So
I love that, Mark.
I love it.
Yeah, sort of, we're getting back to the boots on the ground. I really appreciate that. I think a lot of people in the audience will find that valuable. It just got me thinking of, in rural areas, oftentimes, there's very limited industries, limited employers. And I started thinking about job carving, how much of that, do you guys see happening where you're going into a business and there's not necessarily an advertised position, but there's stuff that it needs done.
Yeah, I don't know how much, and Mark, you can answer too, how much job carving happens. I know, like, I have an example of someone who had photography skills, some creative interests, and after a lot of knocking on doors and doing the networking approach, there was a small business. The guy ran it out of his garage and needed help with building frames for photographs, and just met the person, the job seeker, and they connected. And the job seeker didn't speak a lot of English, but somehow they managed. And he was working literally in this like very small 1 or 2 person business, and just a few hours a week. But I don't know if you would call that carving as much as, it was the two of them connected, and there was a need and an interest. And so there was the match.
Yeah, I would use a different C word, and that C word is creation. So I hear what you're saying, Chris, but that does happen where you're working with some of these smaller businesses and they really don't know that they need this particular service. One of our success videos shows a guy driving a forklift, and he, when you listen to that employer, he brought skills to the workplace, but he also has changed the work habits of the other employees. They're looking at him and thinking, wow, he's doing multiple things at this job. And so they're encouraged and they're excited about work. So, so job creation does happen where you're partnering with a small business and they think of a better way of making the widget, right? And so you have this person that is being supported by an IPS team that can sometimes fill that role.
Awesome. Thank you, Mark. You also, you've mentioned numerous times about how just, it is a grassroots effort, and it does take, sharing the stories and the successes there, right? To before there's buy-in, there's got to be awareness, right? Maybe can you talk a little bit more around some of the strategies that you guys use around, promoting the successes, and how do you get the news out there?
Are you talking about how to promote the importance of IPS, or the
individual success stories, the IPS program in general? I know, Mark, you just referenced the videos that you guys put on, which are fantastic, by the way, and we'll make sure we include links to your YouTube page, but just, those sorts of strategies.
Well, I'm constantly looking for funding. So you kind of alluded to this earlier, Laura, but I know people and have relationships and am working on the Department of Labor funding IPS. I am working with the Department of Intellectual Developmental Disabilities, which in Tennessee is a separate department, and them doing a pilot, funding a pilot where we are using IPS with a dual diagnosis population, that is somebody with an intellectual or developmental disability and a mental health. I am working with obviously the Department of Human Services, but within the Department of Human Services, we just did a pilot with TANF funds, where TANF funded an IPS specialist directly. And so the more, and being a state employee, I would like as many state departments as possible to be thinking about the population that they are engaging or that engage them who have disabilities. And if those people who have disabilities want to work, let's fund it. Let's try it. The Department of Corrections is another agency that or department that we're looking at to build a relationship with. And so my strategy, right, at least for right now, is to get as many state departments involved with looking at the populations that they engage who have disabilities and helping them go to work. That's my strategy. So Laura.
I am right there with you, Mark. Always looking for, you know, a new partnership. If it can help with funding, that's excellent. But I feel like I just carry a flag with me wherever I go that has IPS on it. So any conversation, I try and weave it in. The to, you know, if we have a new commissioner come on board, try and do a presentation to the commissioner, talk about the needs and the strategies that could work and how that fits in with our mission for our department. But at the local level, the mental health centers are putting, you know, positive success stories into their local newspaper. Another mental health center in our smallest county was working with a local television station and trying to do success stories that way. It's really trying to do everything and being persistent and just not giving up, because there will be turnover of key leaders and staff. And so you just have to keep that message strong. I think data also helps. If you can get invited to the legislature to talk about how IPS services really is important and helps people with their recovery, but also just, you know, in general, helping people thrive. So also working with the Department of Labor. I would love to see it be part of all primary care practices, just knowing that employment is one of the key social determinants of health, and that they're asking and then making referrals, right? It's that it is a community-wide effort, not something you get if you are connected to mental health services, but it's just
Right.
a community-wide effort.
You got 4 head nods on that one. Right.
All right, in the last couple of minutes, we did have a comment creep into the Q&A, and it's from Beth in rural Butte County, stand up Butte. And she says that funding and transportation are the barriers that they work with, and also burning bridges with employers and housing and landlords is one of their biggest challenges within their vocational programs. So, you know, getting back to the very close-knit, tight-knit communities and the stigma, and, you know, everybody knows your name. Just, you know, some final maybe thoughts on that.
My late father-in-law said it takes just one, right? So just focus on building a relationship, rewriting the story with one person and amplifying that. You know, if we use the burning the bridge analogy, then you got to rebuild that bridge. And it just takes one.
And using motivational interviewing. If somebody had a really bad experience, hearing them out, learning what was that experience like, and really being there to listen and understand, right? And like Mark said, from that information, you can start to rebuild. I feel like oftentimes when you do that, what you learn is something that actually can be repaired. It's not all or nothing.
Well, I want to offer too that even in urban areas, you have employers that get ticked off on occasion if there's a problem, and creative employment specialists will say, "Oh, I'm sorry that person didn't work out, but I have somebody else that will." And they just get somebody else in that person's place. We've had that experience.
Well, Laura, Mark, again, we thank you for your time and bringing this perspective, you know, to the state of California. I know there's, you know, a ton of folks on here, and there are numerous representatives from rural counties that have joined us. So I'm sure a lot of this information has resonated with them. It has for me, certainly. So again, thank you for your time.